Introduction to food for people with diabetes. Diabetes is a metabolic disease that causes high blood sugar due to lack of insulin in blood. Insulin is a hormone produced by pancreas. It helps transfer sugar from bloodstream into the cells for its energy requirement. In diabetes, body do not make any insulin or produces lesser amount of insulin to remove sugar from the bloodstream. In some cases, the body is unable to utilize the insulin effectively. Due to lack of enough insulin, the levels of sugar in blood keeps on increasing, and at the same time the cells are starving for energy. Diabetes can lead to various complications and associated conditions like high blood pressure, cardiac disease, kidney problems, damage to blood vessels, and many more. Main causes for diabetes. Diabetes can be caused due to heredity. It means due to presence of certain genes in an individual. Lifestyle issues like overeating, consuming more sugar, sedentary life can also cause diabetes. It can also be caused due to old age, pregnancy, and trauma as well. Food for diabetics. Along with an active lifestyle, managing intake of food is one of the very important factors to control diabetes. Planning menus for diabetic require a good knowledge about composition of food and how it is digested and absorbed in our body. Out of the different constituents of food, carbohydrate is the most important in managing diabetes, as the intake of it has a direct impact on the levels of blood sugar. Factors for planning menus for diabetics. Composition of ingredients, glycemic index and glycemic load, cooking method adopted in recipes, portion size served, composition of ingredients. Knowledge of composition of ingredients can help to ascertain suitability of it for a diabetic person. Food with higher percentage of simple sugar like glucose and maltose will be more rapidly absorbed, causing sudden increase in blood sugar levels, hence should be avoided. An ingredient that has a combination of carbohydrate and protein should be preferred, as it will delay the digestion and will elevate the blood sugar levels slowly. Prefer food with higher levels of amylose, as it takes longer time for digestion. Include ingredients with more fibers or roughage, as they are more filling and slowly assimilated. Prefer to use less processed food ingredients, as processing change the level of amylose and amylopectin present in it, making it more readily absorbed. Concept of glycemic index. The glycemic index is a measurement system to classify food on the basis of its effect on blood sugar levels in comparison to the absorption of pure glucose and its impact on blood sugar. For reference, impact of pure glucose is assigned a GI value of 100. On the basis of GI value, the foods are classified as low, medium, and high. Food with GI value less than 55 is considered low in GI. Glycemic index value between 56 to 69 is considered as medium, and the GI value of 70 or more is defined as high. For diabetics, we should select food with low GI score as it will slowly increase the levels of blood sugar. Glycemic load of food. Glycemic load is the measure of the impact of food on levels of blood sugar and time for how long it will remain in the body. Glycemic load is calculated on the basis of glycemic index score and the total quantity of carbohydrate available in the food. It is calculated as the GL score is equal to GI score multiplied by carbohydrate present in grams divided by 100. Ingredients with a lower GL score should be preferred for diabetics. Food with a GL score less than 10 is defined as low. Score between 10 to 19 is considered as medium, and score of 20 or more is considered to high. Cooking methods adopted for diabetic menus. The most preferred method of cooking for diabetics are steaming, poaching, boiling, as these methods do not add any additional ingredients like fats and oils. Grilling and broiling can be used, as such methods of cooking helps in removing excess fat from the food. Prefer to cook food for short duration of time. Overcooking of food will change the structure of food constituents, making it more easily digested, increasing the levels of sugar in blood. Avoid deep frying and shallow frying, as such methods add more fats and oils to food. Portion sizes for diabetics. The portion size for diabetics strictly depend on following factors: severity of the condition of diabetes, type of diabetes, non-insulin dependent or insulin dependent, advice of the dietitian. Portion size will also depend on the main ingredients used for the dish. Requirements of frequent short meals. For better management of diabetes, it is advised to take short, multiple meals instead of 3 main meals. For such requirement, food ingredients that has more fiber and low in carbohydrate should be used. Such snack items should be served in small portion sizes. Examples include dry fruits, salad, yogurt, etc. Ingredients preferred for diabetics: whole grain like wheat, oats, millet, long grain rice, brown rice, fruits like grapefruits, oranges, apples, strawberry, plums, pear, vegetables like cauliflower, celery, zucchini, marrows, legumes like chickpeas, Bengal gram, kidney beans, dairy products like skimmed milk, yogurt or curd, soya milk, almond milk, coconut milk, dry fruits like almonds, pistachios, walnuts, and pine nuts, fish, white meat, lean, red meat, etc. Ingredients not suitable for diabetics: processed grains and products made of it, like white rice, white bread, etc. Fruits like banana, melons, corn and products made with corn, Dairy products like clarified butter and cream, dry fruits like raisins, figs, dates, all kinds of processed foods like jams, jellies, marmalade, and food that contains added sugar, fats and oils, red meat with fat. All such ingredients are not suitable for diabetic patients.